Good morning, everyone. This is Gina Thorne, and welcome to the Lakeview video podcast series. I'm pleased today to be joined with Ken Sieczkowski, who's In2Recovery program based out of Arizona.
Correct.
It's nice to have you here.
Thank you.
Well, we're interested in hearing more about In2Recovery, but before we do that, we'd love to hear more about your background. So how did you get into the field of addiction treatment and interventions?
Well, it started about 22 years ago. I was in residential treatment in Delsman, Wisconsin. So I worked there. My degree's in psychology. So I started there and worked with adolescent males, long-term residential, 6 months to 2 years. I absolutely loved that job. From there I went to Rogers Memorial Hospital in Oconomowoc. So I worked on the floor with the adolescents again. I learned a great deal there. Two of the doctors asked me to start an outpatient program. So I was a director of that program. At that time I began to facilitate interventions. And earlier at Rogers I really learned, I identified that there was a gap in our treatment or continuum of care with families of so many discharges, and families didn't have the resources they needed to continue care. So we were really dropping the ball, and that's where I started In2Recovery. So right now we're working on a platform. We're in beta testing right now. So it's a platform to collect outcomes, algorithms and data of that nature.
So you obviously have great experience in bringing that to the world of interventions, which of course is so important for families who are just having a hard time getting their loved one to move to the next step, if you will. Tell us a little bit about the specifics related to In2Recovery. It's based off the Washington Physicians Healthcare model.
Correct.
And so what would that mean for someone who's not a physician? What would they get from being a part of In2Recovery?
Well, the reason is anybody, any family member can access In2Recovery. So what that would look like is, back up a little bit when you were mentioning that. So I use a process intervention, so to speak. So I'll use some monitoring to integrate people into treatment. So sometimes I'll use monitoring. I'm pretty successful, I would like to think, of getting people in kind of the old school model, but by nature I'm more motivational and working with families of more finesse and really helping them identify where some of their behaviors of how we got here. So it's a much gentler approach, so I'll do kind of pre-case management and so that'll transition them smoothly. So by the time we get there, the family and I already have a relationship. The individual knows me, so when they go to treatment, it's not the big bang, it's like boom, that anxiety is off for the family. So we're doing some probably 20 or 30, my interventions will look more like a process, and then I'll manage them post-discharge.
So do you have so when I hear about interventionists, a lot of times they're willing to make a commitment to the families pre-intervention, then they do the intervention, and then post-intervention they will follow up a little bit, but it's really once that intervention's done, there's not as much as engagement. So what you do is well beyond that.
Correct.
So talk to us a little bit about what that would look like.
So I would like to consider myself a very ethical person. So what I've found in the industry is some interventionists attach themselves to families. I've really struggled with that. So I probably don't sell myself enough on that first meeting. And really what families come to me usually is for intervention. So I usually give them what they ask for. And oftentimes I think, again, where I've fallen short is I don't talk enough about the long-term care. And really, I think I read that the resources are tough. It's just tough for families to get the resources to go to residential treatment, and they're overwhelmed. So I try to honor that process and just respect that. So
yeah, it's kind of it really is sort of confusing. It's almost a quagmire for families because they're already in crisis, and then they're thrown at them so many different things. So it's nice that they've got someone like you who can be a liaison to navigate that for them.
Thank you. Yeah, absolutely. Well, when this day with insurance companies, that's a difficult conversation.
For sure. I mean, that's just one more layer.
It is.
Absolutely.
And that's one of the toughest things that we have to do.
Well, it's really been a pleasure having you here, and thank you so much for coming to Lakeview and visiting with us in Jacksonville. If someone wanted to get access to your services, how would they get in touch with you?
That would be Ken at In2Recovery.com or my cell number, 414-899-9870.
Very nice. Thanks so much for visiting.
Thank you.
Ken.
My pleasure.
And for those of you that are watching today, if you're interested in learning more about Lakeview Health and you need access to residential treatment, please be sure to visit us at lakeviewhealth.com, or you can reach us 24/7 at 866-887-0142.